players that account for the vast majority of cases. Number one, a bacterial infection, H. pylori.
Helicobacter pylori, I've heard of that.
You probably have. It's incredibly common. We're talking like 70 to 80% of gastric ulcers.
Wow.
And even higher for duodenal ulcers, maybe around 90%.
90%. So most ulcers are caused by a bug.
Yeah.
How does a bacterium do that?
It's quite clever, actually, in a nasty way. H. pylori weakens the stomach's natural defenses. It produces this enzyme, urease, which neutralizes stomach acid right around the bacterium, letting it survive. But crucially, it also releases toxins that directly damage the mucosal cells.
Creating weak spots.
Exactly. Weak spots for the acid and pepsin to then attack.
Okay, so H. pylori is huge. What's the other major cause?
The second one might surprise you. It's the regular use of NSAIDs.
Non-steroidal anti-inflammatory drugs. You mean like aspirin, ibuprofen?
Precisely. Aspirin, ibuprofen, naproxen, diclofenac, those everyday painkillers.
Wait, how can painkillers cause ulcers? They just stop pain, right?
They do, but they have a side effect. See, NSAIDs work by blocking certain enzymes involved in inflammation. But in doing that, they also block the production of something called prostaglandins.
Prostaglandins. Okay, why are they important?
They're vital for stomach protection. Prostaglandins tell your stomach lining to produce more protective mucus and bicarbonate that neutralizes acid. They also keep blood flowing well to the lining, which helps with repair.
Ah, so NSAIDs reduce those protective prostaglandins.
Exactly. Less prostaglandin means less mucus, less bicarbonate, weaker defenses. The lining becomes much more vulnerable to acid damage.
So it's not just bacteria, it's also potentially the pills you take for a headache. That's quite something.
It really is. Those are the big two. But there are other, less common, but still significant major causes.
Like what?
Things called hypersecretory conditions.
Yeah.
Basically situations where your stomach just makes way too much acid.
Okay.
The classic example is Zollinger-Ellison syndrome. It's often caused by a tumor, a gastrinoma, that pumps out loads of a hormone called gastrin. And gastrin just tells the stomach,
Make acid. Constant acid production.
Right. Also, high calcium levels in the blood, hypercalcemia, can sometimes stimulate gastrin release too.
So